I'm starting the record. Also, I'm starting the program. Dear participants, as MASAM and Young MASAM, we are here to celebrate the Africa Day. Africa Day highlights the success of African unity since 25th May 1963 in the fight against colonialism and apartheid, as well as the progress Africa has made. Happy Africa Day to all. Firstly, I would like to thank all of participants around the world, primarily our speakers, Dr. Mustafa, Dr. Aminu, Şevval, and Ömer, and also our Honorable Professor, Dr. Orhan Alimoğlu. We are starting the program with Professor Alimoğlu's speech because of he's on the way at the moment. Hatice İlke will conduct his greetings to us by proxy.
Thank you, Feyza. Dear participants, I celebrate the May 25th Africa Day, all of you. With all my heart, I wish the African people to reach the place in the world that they deserve economically and medically. I would like to thank the MASAM President, Ferdi İrem, and all MASAM members who organized this meeting to know Africa from a closer point of view in order to make small contribution. I also would like to thank each of the speakers, including the young doctor from Nigeria, Dr. Aminu, my young colleague from Uganda, Dr. Mustafa, as well as Ömer and Şevval, who will make speeches from Turkey. I wish this meeting to be successful and greet all participants with love and respect. Professor Dr. Orhan Alimoğlu.
Thanks, Hatice and the professor. Our first presentation is from Nigeria. Dr. Aminu Umar going to tell us how the real Africa looks like.
Okay, good evening, my fellow brothers, MASAM and Young MASAM, and our noble and able Professor Orhan Alimoğlu in his absence. This evening, I will briefly talk about how is the real Africa. Although from the beginning this is a broad term, it's a big discussion for me to cover because Africa has over 54 countries, which I have not gone even at 0.2% out of those countries. So I will try my best and summarize according to research. Here are my data. I live in Sokoto, but currently in Maiduguri, where I practice my medical knowledge that I got from Uganda. So on this Africa Day, I would like to go to the next step, next slide.
Okay.
Yes, these are the outlines I wanted to highlight. The history of Africa, which is a short slide I made, population, developing and underdeveloped countries in Africa, health situations, because as MASAM, I know the much emphasis is made on health basics and economic aspects of our life. So the challenges and the possible solutions to those challenges that most of the African countries face. Then conclusion and references. Next, thank you. So here is a map of Africa. As you see, my country is located somewhere down Nigeria. Yeah, thank you. That place. So that
in Nigeria, I think upper. If I can zoom it, I would have shown you if I will be able to where I stay in Nigeria and where I currently am. Thank you. Next.
Okay.
So this is a brief history of Africa. We have 7 continents in Africa. In the world, 7. And Africa is the second largest when you exclude Asia. We are the second largest in continent in the world. With about, this is the kilometer square that is covered by Africa. This is a research done about 30.3 million kilometers square, which is a huge land when you compare. By that, 11.7 million square miles. So this also includes the adjacent lands like Saudi Arabia, those close Asian country, Portugal, and among others. And then about the population-wise, in Africa, we have about 1.3 billion people in Africa, where in Asia, that's where we have about 2 billion, 1.9, and among others. We have about 54 countries with about 3,000 tribes. So we have a lot of diversity tribes. There are many in Africa. And we have also many religions, but the main two religions
that are in Africa are Islam.
I think because of the internet, Dr. Aminu's lost, but I think he will came again.
He's coming.
Okay.
I'm sorry for that. As I earlier told you, I'm having problem with network here. Yeah, so these are the, so next slide, thank you.
Okay.
So health problems in Africa, because most of the countries in Africa are developing. Only few, most of them are underdeveloped, I can say. Only few are developing. So without access to medicines, African are susceptible to this.
three big killers disease in their continent: malaria, tuberculosis, and HIV. And HIV is a global burden, likewise tuberculosis, but mainly in Africa, due to these problems, lack of access to well program health service, that is the problem. And that's why we have much of under 5 mortality in more in the Africa than any other continent. With this, we have those under 5 mortalities, which are also a more burden in Africa than any other, like pneumonia, diarrheal disease, measles, still HIV, tuberculosis, but malaria are more in Africa. This is research that I've seen in World Health Organization page. So I think it's a benefit to share it with you so that at least just to remind you. I know if you are in medical practice, you have to go through such. You will have to go through a lot of papers, and one day you will come across it. So it's just a reminder. Thank you. Next. So the health problems, as I start mentioning, one of the issues we have is cost effective. In most of the African countries, we don't have, I know it's very hard. You will find a country that you say, this health system is free. It's hard. Even if you're not paying for it, someone is paying for it. So, but here, it's more pronounced. The problem is more pronounced, as in we have a lot of issue. Cost-effective things are very costly, and
Yes, we can see you, Doctor.
okay, thank you. Then we have poor infrastructure, lack of equipment and for both therapeutic and diagnostic purposes. Then manpower is also an issue. In manpower, then insecurity is another challenge. Poor roads, which we will see a lot of RTS, road traffic
accidents, and then the health care and patient ratio is also another burden, because like in Nigeria, a single doctor is supposed to see about 54,000 people, which is not realistic. A single doctor cannot see even 100 or 500 patients in a day. So we are having that, and sometimes lack of funds, which also contribute to the downward ratio of our health system. Next. So the challenge is, one of the big challenges we have is poor governance. And then what I'll talk about in solution to the problem is, we will cover that we have terrorism, the culture,
they affect our development, because there are certain culture that prioritize their cultural practice than development of their own community. So that thing also affect our development. Then religious affairs, it's also same way, like in cultural aspect. Then poor maintenance or management. This management, the people that are interested to manage a certain system, you will find out that it's very high for someone to manage maybe an equipment, or being it either for therapeutic use or for diagnostic use up to a certain level, because we have, most of the African, we have the impression that when something is for the government, we just use it like, so that thing also contribute to our, then insecurity. Insecurity falls under everything, because we have a lot of issue, like worldwide violence is everywhere, but it's more in our regions. Then lack of inadequate infrastructure. We don't have much of infrastructure to help or to accommodate most of our patients that we see as outpatient or inpatient for their management. Among others, we have many others. So because it's just short presentation, that way I selected this major hits. The last slide, next slide, second last, I think. So for me, according to me, and according to what I have researched, the possible solutions begins with us, for us that selects the leaders. Because if you want really to have a good taste of the food, you know that you have to prepare and spend a good amount of money to make it sweet. So if we want to really our continent as an Africa to develop, we have to carefully select our good leaders. And there are very many good people among.
We know them, only that most of the times we try to divert due to some other issues and select someone that is not even close to a better person. Also strong partnership, which will help us. And then we also have to fight terrorism together, because we have seen it in different parts of the world that is done. It's not left for the government only to fight. It's also among us, because at the long term, it comes back to us. The destruction for the houses is ours. The companies are ours. The hospitals, we are the one benefit. The richer people will just go outside Nigeria or outside Africa and seek for better health and better education, while the average African is the one to suffer. Then avoiding cultural and religious conflict, which is this can be achieved by educating our people on the need of our development, which will only take us nowhere but downward. But as long as we avoid these conflicts, our flag will raise up. Then we need to be actively participated in helping our leaders to develop our country. Then adequate health education is also very, very important in achieving this goal. And the last slide. So this is just a snapshot on how the economic aspect of Africa is going through. As you can see, Egypt is between Egypt, Nigeria, and South Africa. But you will be shocked or surprised when you come and find out that what is displayed here is not what is on the ground. So Africa
as one of the best continents with natural resources. No any other continent or any other continent. Most of the countries in Africa have better resources, but all that I've mentioned has contributed or is contributing continuously to our downgrade because we have the resources, only that we don't know how to use them and utilize them to become a better people. So I think in our time, with also
MASAM, we can achieve that, I think. Next, so in conclusion, finally, as I mentioned, is the second largest continent after Asia. Then there has been ranked the best natural.
This is a study that
done by this philanthropist.
They have gone around Africa. If you need gold, it's in Africa, crude oil, hydrocarbon, everything is stored in Africa. But those who are sitting under or above that resources don't know how to cultivate it and use it and help their community. Only that our aim and our leaders most of the time is to loot, to enjoy life, which is not the case. So these resources are actually making the citizens, while they have the best resources and they have the best people who suffers in life, both in health-wise, infrastructurally, which as a result of what I've already mentioned. So I think in our time, we will try to see how we think we can improve from individual up to the country and continent level. I think with the help of MASAM and the guidance of maybe such good professors like Professor Orhan, among other professors in Istanbul, we can achieve that, inshallah. And we have a good friends like Yusuf, Freddy, Ömer. So I think we can achieve that. We can become better and better, inshallah. With this, I would like to stop here. As I told you earlier, I'm in emergency pediatric unit, and it is big, hectic. So I may not be part of the meeting throughout, but I will be coming and going because we have a lot of emergencies. I just requested for this minute to present my presentation. Thank you very much. In case there is any questions, clarification, I will be glad to answer it. Thank you.
Yes, we can, if you have questions, you can ask. Also, I want to thank you for your beautiful presentation, Dr. Aminu. Also, your participating. If you have a question, you can text it to the chat, or you can ask directly to Dr. Aminu. Any questions? Okay, if you have not, thank you, Dr. Aminu again. We are continuing the program with the next speaker from Turkey, Muhammed Ömer Kurnaz. He will mention about the maternal, newborn, and child health in Africa. Ömer?
I can't hear.
I'm sharing my screen.
Okay.
Hello, everyone, and thank you to Dr. Aminu because of the good presentation. And now I have a very huge topic to explain: Africa's silent epidemic, maternal, newborn, and child health. But I will try my best to explain this topic to you today. African silent epidemic, uh, as I say, millions of women, newborns, and children in Africa are dying from preventable causes every year. Preventable. Millions more suffer ill health or disability related to pregnancy and childbirth. It is the enormity of this that disease and disability that constitutes Africa's silent epidemic. In 2004, all 46 member states of the African region agreed to improve maternal and newborn health through the adoption and implementation of the roadmap for accelerating the attainment of the Millennium Development Goals relating to maternal and newborn health in Africa. Nearly 35 years after the launch of a major global campaign, the Safe Motherhood Initiative, there have been pockets of improvement in maternal, newborn, and child health in the African region, but no overall reduction in pregnancy and childbirth-related death and diseases, according to World Health Organization data. During the 1990s, the countries with the highest tolls of maternal, newborn, and childhood disease, and that made the least progress in reducing them. A few countries in the African region, such as Cape Verde, Mauritius, and Seychelles, have very low maternal, neonatal, and child mortality rates that are comparable with those in industrialized countries. The main causes of maternal death are severe bleeding, infection, eclampsia, obstructed labor, and unsafe abortion. But also, increasing numbers of mothers in this region die from indirect causes such as HIV, tuberculosis, malaria, and anemia. Of the 20 countries with the highest maternal mortality ratios in the world, 19 are in Africa and one is in Asia, Afghanistan. The African region accounts for about 10% of the world's population and 20% of global births, yet nearly half of the mothers who die globally as a result of pregnancy and childbirth are in this region. Pregnancy and childbirth-related complications were the second leading cause of death and disability for women aged 15-49 years in this region. According to World Health Organization data, the leading cause was HIV. Uh, I we say apart from the personal tragedy for the children and families concerned, the deaths of so many mothers in pregnancy and childbirth is a disaster for communities and a major setback for the economic and social development of countries. A woman in sub-Saharan Africa faces a 1 in 16 risk of dying due to pregnancy or childbirth during her lifetime, compared with 1 in 2,800 in developed countries. A study in West Africa showed that for each maternal death, a further 30 women may suffer long-lasting disabilities due to a range of conditions such as chronic anemia, infertility, and obstetric fistula. Harmful traditional practices such as female genital mutilation and nutritional taboos also contribute to poor maternal health, according to WHO. Female genital mutilation, which is the partial or total removal of external genitalia, is practiced in 27 member states of the 46 in Africa region. The main causes of neonatal death in this region are severe infections, birth asphyxia, preterm birth, neonatal tetanus, congenital anomalies, and other conditions. As you see, figure 2.3. In developing countries, the children of mothers who die during the first 6 weeks are up to 10 times more likely to die within 2 years than children with two living parents. The reason is that the babies don't get breastfed, the family food supply is threatened and there is no direct care for these children. The dead women's children are also less likely to get adequate health care and education as they grow up. They grow up. Data from WHO report show that neonates represent about 40% of children who die before their fifth birthday, and that 29 of global neonatal deaths occur in Africa. The African region's neonatal mortality rate is the highest in the world. Also, I have a note, for every newborn baby that dies, another 20 face illnesses or disability from conditions such as birth injury, infection, and the complications of premature birth. The vast majority of deaths of children aged under 5 years in this region are due to preventable causes. As you see in figure 2.5, shows that the chief causes are neonatal conditions, acute respiratory infections, malaria, diarrheal diseases, HIV, and measles, all complicated by malnutrition, of course. The importance of malnutrition as an underlying cause of death for children aged under 5 years has been recognized for many years and has recently been reconfirmed. Uh, 53% of all of these child deaths could be attributed to underweight, and 35% of deaths are due to the effect of undernutrition on diarrhea, pneumonia, malaria, and measles. Deaths of children under 5 years of age are increasingly concentrated in the African region, at 43% of the global total in 2003, up from 31% in 1990. Every day, an estimated 12,000 children die in sub-Saharan Africa from easily preventable or treatable illnesses and conditions such as pneumonia, diarrhea, measles, malaria, and malnutrition. Figure 2.6 shows that mortality of children aged under 5 stagnated between 1990 and 2003 in 29 countries globally, and that 23 of these countries were in Africa. The number of under 5 deaths has increased, and during the 13-year period, there has been no overall reduction in child mortality in this region. The tragedy of maternal, neonatal, and child mortality today is that the vast majority of these deaths can be prevented by making sure pregnant women and children have access to good quality healthcare. Millions more lives could be saved if health systems were developed to ensure that services are of high quality and extended to everyone who needs them. Education, illiteracy, and the women's lack of economic power, compounded by their low social status, contribute to women's low utilization of available health services. Other major factors that have led to inadequate coverage of maternal health services are poverty, weak health systems, and the shortage of skilled health workers. In some parts of the African region, about one-third of pregnant women are adolescents. Adolescent mothers face a greater risk of death in pregnancy and childbirth than women aged 20 or over. If these adolescents had access to family planning services, many deaths and much ill health could be avoided. Over the last 2 decades, the African region has seen more armed conflict and humanitarian emergencies than any other. In humanitarian emergencies, I think pregnant women still need routine antenatal care and skilled assistance when they give birth. And if there are complications, they need backup services, including emergency obstetric and neonatal care. For example, of Sierra Leone. After a devastating 1991 and 2001 civil war, the West African country was estimated to have the highest maternal mortality ratio. Uh, HIV has had a dire impact on maternal and child health over the last 2 decades. In some African countries, an estimated 20 or 30% of pregnant women are infected with HIV, while transmission rates from mother to child range from 25% to 40%. Want to say something. HIV has in turn increased the reemergence of tuberculosis and complicated forms of malaria, and all three have become the biggest indirect cause of maternal and neonatal death in this region. Uh, inadequate resource allocation. Many governments in this region are aware of the magnitude of the problem, but are prevented from allocating adequate resources to maternal, newborn, and child health care by poverty, armed conflict, or humanitarian emergencies. Public health experts broadly agree that widespread exclusion from good quality healthcare are at the root of the problem. Indicators of the quality of antenatal care reflect how well this care screens for major complications of pregnancy and childbirth and prevents them. Health systems also serve to gather reliable data. One of the main challenges for improving the health of women, newborns, and children is gathering data to measure progress. Many countries with the highest burden of maternal, newborn, and child death and disease lack reliable data which they need to gauge an adequate response. More than a decade of research has shown that modest, low-cost measures can significantly reduce the health risks that women face when they become pregnant. For instance, educating the woman to look after herself and recognize danger signs that indicate when she should seek help at a health facility. These measures also include providing basic and regular antenatal care to check blood pressure, weight gain, and renal function, diagnose anemia, and treat infections. Also, I want to say that breastfeeding is one of the best ways to ensure the baby's survival. Safe Motherhood, who launched the Making Pregnancy Safer initiative in 1999 to assist countries uh, to strengthen their health systems to improve access to skilled care, including access to emergency obstetric and newborn care. But critics argue that countries are not given the technical assistance they need to implement. But uh, prevention of mother-to-child transmission of HIV. We said that HIV is the most common that uh, the root thing for the maternal child and newborn death. Countries in the African region started introducing the prevention of mother-to-child transmission of HIV program in 2002. Its goal is also to prevent men and women from becoming infected with HIV and to prevent unwanted pregnancies in HIV-positive women. A successful pilot project conducted in a clinic in Zimbabwe in 2001 showed that PMT-CT programs are more effective if clinical treatment given to HIV-positive mothers is combined with psychosocial support for those mothers and their families. Developed in the 1990s by WHO and UNICEF, the integrated management of childhood illnesses strategy is being implemented in 44 of the 46 countries of the African region to reduce the growing number of child deaths attributable to a few preventable, treatable illnesses. The idea of IMCI is to improve the prevention or early detection and treatment of the main childhood killers in developing countries. There have been reduction in child mortality in some countries that have implemented IMCI. Malawi and Mozambique have managed to lower their child mortality rates over the last 10 years. The United Republic of Tanzania reduced the mortality of children aged under 5 years by 13% over the 2-year period from mid 2000s to mid 2002 in 2006, where IMCI was part of a comprehensive strategy to improve access to healthcare. Studies show that in countries where births are increasingly attended by skilled health workers, maternal and newborn deaths decline. African region members should improve the health worker skills, fine-tune the organization of maternal, newborn, and child health care service delivery, and promote health education and community involvement in pregnancy, childbirth. Also, immunizing more women and children is important. Immunizing can do much to improve child, newborn, and maternal health, but its potential has still not been exploited to the full in the African region, as we see in COVID-19 pandemic, where Western preventable diseases remain a major cause of death and disease. These are hopeful examples. Cape Verde, Mauritius, and Seychelles have improved maternal and newborn health through public health education, including education for girls, family planning, and strong political commitment to HIV prevention and care. Similar best practice implemented in Uganda Sorority District in 2001 with the adoption of the Making Pregnancy Safer initiative have also reaped positive results. Also, you can see another two example here. Uh, these are my endnotes. In much of the African region, there has been little or no improvement in maternal, newborn, and childhood since the end of the 1980s. In some parts, some of the gains of the post-independence years have been reversed. However, there are interventions that work in the African setting, and the key to success is the scaling this up effectively. Many people in African countries don't go to a health facility when they need care. Increasing the quality of care at health facilities alone wouldn't reduce the maternal, neonatal, and child mortality rates significantly. Essential healthcare needs to be brought closer to the community. Scaling up health systems is vital, but will not be effective if many people, particularly girls and women, remain uneducated about their health. Lack of education and illiteracy are major challenges in this region. Also, one of my most used words on the slide is preventable. This motivates us to work on this issue and to produce new projects together, inshallah. And if necessary research and studies are provided, significant success can be achieved. Thanks for listening to me.
Thank you, Ömer. If you have any questions to Ömer, you can ask from chat or directly. If you have not, we can continue with the other presentation. Thank you, Ömer.
Thank you.
You can close
Thank
your
you, Dr. Umar.
Okay. Dr. Emine, do you have any question or?
Yes, Dr. Umar.
Yes, Dr. Aminu, I can't hear you. Sorry.
The slides,
Yes.
there is where you showed, is it the under 5 mortality? Not this one.
One moment.
Wait, that's here, this one.
Yes.
So this indirect causes, these are the ones I was confused about, direct and indirect causes.
Yes.
Hmm.
You
I
ask
didn't get it.
what are they?
Clearly.
Do you ask me what are the indirect causes and other direct causes?
Yes.
Other direct causes, I don't know. I'm sorry, but indirect causes in the presentation, as I said, I took from World Health Organization African Health Report, tuberculosis, malaria, and anemia.
Okay.
Okay.
Okay. Thank you.
Okay. We are going back to Africa again. Dr. Mustafa from Uganda is going to speak about the real health situation in Africa. If you are close your sharing, Ömer, Dr. Mustafa can share his own. Okay. You can share your presentation, Doctor. Okay. We are listening to you.
Okay. Assalamu alaikum wa rahmatullahi wa barakatuh. Alhamdulillah, glad to be with you here. This is Dr. Ssaka Mustafa. I will present the real Africa, a fortune for the global health. In line with the presentation. I am medical director of Saka Community Medical Center, a few meters away from Kampala. I did my bachelor's of medicine and surgery at Islamic University in Uganda, Habib Medical School. And currently I'm doing a master's in physiology at Makerere University, which is Africa's best 50th university in a global ranking in Africa, and 600 within the world university rankings. This presentation is to the Young MASAM, that is on this day of African Health Day. So, yes. So the introduction stands as Africa is home to 1.37 billion people. It is the second largest population behind Asia, as shared by the previous presenters. This is mainly contributed to mainly by Nigeria, Ethiopia, and Egypt, with an annual increase of 2.58%, that is for Nigeria, 2.57%, that is for Ethiopia, and then 1.94% respectively. This shows that the African population is growing at a very fast state, better than many of the other countries. However, Africa's health workforce is 2.3 per 1,000 people. So meaning if you have 1,000 people, you have 2.3 health workers, irrespective of whether it's a doctor, a nurse, clinic officer, or a paramedic. Then compared to the Americas, where it is 24.8 health personnel per 1,000. So this really shows that the Africa's health workforce is still very small and needs to be developed, and it needs to be widened. Health systems in Africa suffer from neglect and underfunding, leading to severe challenges to its population. This was from the World Economic Forum. So, common sins in Africa. Whereas you enjoy the streets of Istanbul, Izmir, and other parts in Turkey, maybe in Europe, maybe in Saudi Arabia, if you have visited them, Mecca particularly, this is how you will find some of the typical situation in Africa. On my, can you hear me very well?
Yes, we can.
Yes, so on my, can you see my pen?
Yes.
Yes, so this is one of the economic activities. A group of women and men go and till a land and they are paid. And this yield for commercial agriculture. And then this is a typical day for an African woman. She goes to the field to till the land, collect some food, fresh food, and then here they are from digging. So most of the food that is tilled from the land or harvested, most of it ends up in being eaten by the family, which we refer to as subsistence farming. And then within this picture, this is a common form of transport in the real African situation. And most of the roads are like this. They are MASAM roads with less maintenance. And these are typical houses. And whereas you use the washing machines, in Africa, we still use the sun to dry the clothes. And these are some of the housings where the individuals are. And these are the children. And then on the right here, in case there is any conflict in Africa, you will find that such lines, a group of people are collected into a camp so that they can be taken care of. This is a scene where you are seeing that this food that has been prepared by these ladies is going to be served to a big number of people. So in my topic, we are talking about the real health situation in Africa, but we cannot talk about health when we don't talk about the other factors that will affect health. Just like my colleague said, this is the global map, which shows the global population. Like you can see Asia, it is around 4 billion, and then here is Africa, and then here is Europe, and then other areas. So what is the insight? Despite the challenges, success has been achieved through various international collaborations with African countries. This has led to increased literacy rates of up to 66.8%, meaning that the people who are educated now currently has improved in Africa. Like we know, education is very important in transforming people's health and people's well-being and health status. So this is a good news in Africa. There is improved internet coverage. In one of the reports by the Global Survey, it showed that currently African internet coverage is at 22%, while Europe it is at 80%. And then I gave a comparison of Asia Pacific and also the Arab world, which has 44%. Whereas you may see that Africa has an internet coverage of 22%, the Arab world, which cannot easily be compared with Africa in terms of health, is only at 44%. So it is a long journey to cover the internet. While the internet, most of the health-changing ventures, research, and various activities, the internet and the computer are very important. The data we see must be synthesized through various models that are on the internet and also comparison of the health systems. That's why this has to be covered here. So there's improved health service delivery. This was in one of the reports in one of the African journals by Kelly Churian of 52%. So it is not only the bad news in Africa, but slowly by slowly there are various achievements like we can see. So when we see there's increased traffic flow, that is in the transport sector, in terms of aviation, the flights, various people are finding Africa as a good hub and destination for traffic in terms of air transport, in terms of road networks, and in terms of water, where various foods are brought in. Like, for example, have the World Food Program, which comes to the rescue of people in conflicts, in the refugee camps. All that food at times may be shipped in from other areas or may be flown in. So you find that transport is really relevant to the health sector, and in terms where the governments cannot help, other international agencies are ready to help. Food and agriculture, because of the good climate and weather, this is not a big problem except in areas where there is conflict. The fortune, where is the advantage? So in line with the successes above covered, coupled with relative peace and stability, various governments, multinational corporations, and agencies are working with various African countries to improve the quality of life, just like I've mentioned in the previous slide. So since Africa is projected to be the next global hub in business due to its ever-increasing population, it's a fortune to explore in terms of innovation and research. So at this point, I call upon the Young MASAM during this African Day to change your perception about Africa. Despite the various challenges Africa goes through, it is an opportunity for you to find more about Africa, not only on the side of its darkness, but also on the side of its light, like my presentation has shown. Young MASAM, please look through. This is the African projection. This is the African population projection. It is believed that by 2060, we shall see the African population rise steadily to close to 500 million. These are percentage increase. You're seeing in the earlier days, the population was very low, just like in Europe, just like in Americas, just like in Asia. So the population was a bit low. This was mainly attributed due to instability, hunger, and lack of education and lack of knowledge to keep the health. So you're seeing that apart from the Latin America, the Caribbeans, North America, the Oceanias, and Europe, Africa and Asia will be steadily increasing in their population. Whereas Asia will be lowering down for factors that will be highlighted in the presentation, Africa is seen to be on the rise. So as Young MASAM, I give you a question that is this a fortune or not? So it's up to you to assess and then find out. Still on that side of the African population projection, it is projected that by 2100, Nigeria will have a population of 788 million, and it will be projected to be the largest in Africa, and currently it is the largest. And then the Congo, the Democratic Republic of Congo, will be second, followed by Tanzania, Ethiopia, and then my country, Uganda, will follow. The Egypt that we saw will be lowering down. So all these figures are a highlight to show us as young doctors, as young people in the medical world, as future leaders, what we need to think about. So, opportunity or a threat. It was found out that 77% of the population is below the age of 35. So this was from the World Economic Report Forum, that was 2020. So when you have the biggest percentage of your population below 35 years, these are young people. They need education, they need internet service, they need water, they need food, they need to acquire new knowledge, innovation, and research. So as Young MASAM and my dear presenters, or my dear panelists, or our dear professor, so is this an opportunity for us or a threat? So all of us, this is a question we have to answer as we carefully celebrate this African Day. So how does Africa currently spend its money in terms of the governments? In a research that was done by African Health Observatory report, it showed that when you see my cursor, the areas in red are the areas that have a very low percentage allocation of their money to the health sector. The example here, as I try to show you, you can see that most of the countries here, none of them can submit their health budget beyond 5%, like you can see here. The highest, the one in the red here, less than 2.5 of their GDP, less than that. Are you seeing? So how will we have very good health if governments are not committed to their health structure, to the health improvement of its population? And the one is in yellow, they're the ones which can spend at least 2.5, okay? Some other countries here are seeing here in dark, they don't have anything. Their data cannot easily be traced. This was a report that was done way long ago, but I found it very important. So this explains the maternal mortality, the challenges that our dear brother from Turkey has presented about the challenges that children are dying, pregnant mothers are not able to access their health, and then the infrastructure in the health sector as presented by Dr. Aminu. So no wonder, this is what the governments can commit to their health status. It is only a few countries that can get close to 10. The one is in green, 1, 2, 3. You can even count them. But it is realized that the biggest percentage can only commit 2.5 to 5.8. So this is with all. Yes, population growth, but life expectancy. As much as we have seen that the African population is projected to be the leading in the world in the next years, but when you have a population of 77% below the age of 35, what quality of life will they receive? Okay, so this was a report still by WHO showing how the African males and females will be faring. It is a global report. Globally, a woman will live longer at 71 if you get the average or the mean, and the men slightly live a lesser time. So this is projected through the global statistics. But in Africa, we are seeing that we have the lowest life expectancy. If you combine all the countries in relation to their GDP, you'll find that the men will be at 50 years and then the females will be at 60 years. So as the population of Africa grows, we need to ensure that itself is in good shape. So what are some of the health challenges, African health challenges? According to Obinan and others who did a survey, the challenges they identified were inadequate human resource. As highlighted in my introduction, we saw that 2.3% is what Africa has for its population per 100,000, way below to that of the Americas, which was at 24.8%. So we are seeing that in even a report done by one of the African leading researchers, the human resource in Africa stands at, this is for health, in 34.29%. So there is inadequate budgetary allocation to the health sector. So that has been highlighted in the previous presentation. So these percentages, you're seeing that if you went and asked all the African countries, what is the problem? Why isn't the health improving? We don't have the doctors, we don't have the nurses, we don't have the physicians, we don't have the surgeons, we don't have the obstetricians. So most of the countries, they will tell you that there's inadequate human resource. The second problem will be, yes, the government can construct the hospitals, can bring the infrastructures, but where are these people to work in them? It is estimated that this is the second underlying problem after the budgetary allocation. Since you don't have human resource, so governments will put in less money. And then poor leadership and governance and management of all the structures, the infrastructures, from politics and others. So because of poor leadership and governance, you find that the health sector in Africa will be lagging. And this report tried to highlight some of the solutions. The leading solutions that still were suggested by this survey is training and capacity building for the health workers. So still when you ask to the African countries and the different people within Africa, you ask them about which solutions can be provided. We need to train and train and train and train. Train the health workers who can serve the mothers to reduce on the maternal mortality rate. Train the pediatricians and nurses to handle all the paramedics, to handle the children itself deep there down in the villages. You remember that the literacy rate was slightly rising, but in the health sector, still the numbers are very low. So the second solution that was still suggested is the government should increase the budgetary allocation to the health sector. So once money has been put into the health sector, this means the health workers will be paid, and when they are paid with satisfactory funds, we shall see an improvement in their delivery, and then the health sector in Africa will start to be in a good shape. And then the last option this report highlighted, it was advocacy for political support and commitment to the health sector. So these are some of the common sins. Forget about Medeniyet, Gustav, the scenes you see there. I was there, it is now called Slimania Hospital. This is a situation in one of our national referral hospitals. This is one of the biggest referral hospitals in Uganda where patients can lie down. These are mothers who have just delivered. So the beds are very few, and now mothers with their caretakers. Are you seeing this baby here? Are we together? Can you see me? Are we together?
Yes, we are. We can
Yes.
hear you and we can see your slide.
Okay, so this is a mother about to push. See the environment, she's walking barefooted, and yet the hospital has a lot of pathogens. So this is the true practice if you come to Africa. It may not look pleasant, but it is worth sharing for you as Young MASAM to reflect on. So this is the kind of cannula, and this is what is done, okay? This is a common situation in many African country healthcare facilities. In some settings, it may even be worse because this is located in the capital city of Uganda, that is Kampala, where you think at least the health sector should be at the top notch. So crowding is very common. crowding is very common, just like you can see for yourself. So any solutions, maybe. So that picture was taken some years ago, not more than 5 years ago. So we have a slight shift, the shift. So what you're seeing here on my right, this is the emergency department of a national referral hospital in Uganda. National referral hospital. It is just a single room, okay? This is not surprise to you because this is what the government has been able to allocate. But remember, this is a national referral hospital. Where will the doctors pass? How do they help these patients? That is a question for you and me. And then this is the neonatal unit. Despite a slight improvement with a slight shift, still you can see that there is still congestion. Is a transfer. No wonder antimicrobial resistance. Still the same. These are the words, like you say, this is the real situation. Okay? We have here a bare oxygen cylinder, no emergency in case it falls down and it ruptures. This is a baby. This is a group of mothers, and this is the what? This is the health worker. And to make matters worse for you to understand the situation, is that most of the health workforce in African countries is done by interns, doctors who are in practice because they have good number and they can be paid very little money. Governments will always use that opportunity. When we talk of Africa, we are not talking of Morocco, we are not talking of South Africa, in Cape Town, we are talking about the deep down situation. However, this is a lighter situation because this hospital is not very far from Kampala. So these are the scenes. All the patients here are lining up, and this is the crowding that we are talking of. Yeah, despite those scenes, I welcome you back from that flashback of the nasty presentation. After various alarms, reports, and sharing with various donor agencies, glad today that in Uganda we have the first women's hospital, which is here, and these are the admission room. Though still, you have to get this at a cost, okay? You have to get this at a cost. Whereas I found this in Istanbul, Mustafa Sulaimania Hospital, as a public ward, this is government that you pay some slight fee. So we don't have national insurance. So maybe if it is there, it would have worked. So these are similar things, okay? Though various development partners, through various development partners, the situation is slowly changing. This is what I'm showing. This is a replica in various health institutes, such as the Heart Institute, the Cancer Institute, Orthopedic Institute, Research, and Neuro. Pending other areas with no funding collaborations include the general surgery, GIT, biomedical research, emergency medicine, only to name a few. Is there any hope? What opportunities does Africa offer to you? In Africa, research is on the rise. For what you have seen all through, if it is documented through research, it is easier to get bigger grants from multinational organizations and other World Health Organization agencies to try to improve the situation. And I think this is the core reason why we are having the African Day, thanks to the great brain behind it, Professor Orhan and students of Istanbul Medeniyet University. So let us keep the hopes alive. So we can do various researches in various fields of medicine and then surgery. Institutional collaborations for various projects that can transform humanity. It's not only in Africa. Whereas we enjoy the good scenarios of America, Europe, Asia, and other countries, we are all humans. So any contribution to changing of the situation in the African continent is a true heart of humanity. Just like MASAM, we wish you a nice journey towards the achievement, the goal of its establishment. Education opportunities through students' exchange. In the question that I was given to present, the real health situation in Africa, following this presentation, you can make a visit in various African countries and get to understand and see the opportunities. Many Europeans that visited Africa before and Americans have gotten a big opportunity and done great researches that have transformed this world. Young MASAM, please feel free to come and visit Africa. We have Dr. Aminu in Nigeria, Dr. Ssaka in Uganda, and other states of Africa where you can learn more and maybe share the ideas and share research collaboration. Cultural exchange, when there are various visits, a lot can be learned. Other areas of focus, water and sanitation. You can't talk about health and forget about the water and sanitation. We have a new field now. The biggest population of youth in Africa, who are 77% of its population, are now using the smartphones, telemedicine. A lot of research can be done here, whereby a young youth in Africa, deep down in any village, which can access internet, since we are seeing the internet connectivity is increasing, can change the health of their village through telemedicine. These collaborations are healthy. These areas, maybe they have been done in Europe or in Turkey, for example. They can be a model that can be tested in various areas in Africa. This is a new field of technology that is developing. Nutrition. Health and nutrition cannot be separated. As long as people feed well, despite the good food that is in Africa, various nutritional developments need to be done to ensure that the maximum benefit is done. Because even if you have the food, without knowing the right proportions you are supposed to take, you may end up with other diseases, just like the next presenter is going to be to talk about non-communicable diseases such as diabetes. Education, we need to also focus on education, sharing knowledge and students exchange, like in the previous presentation. Community medicine, a visit in Africa. It is very good to share with the various communities and understand the true spirit into which these vulnerable communities are going through. This is in line with also humanitarian services. Some works done by the Turkish community in Uganda. We have seen that the Embassy of Uganda, this is the ambassador of Uganda, Mr. Ali. I met him some months ago. They are transforming, they are trying to work through TICA to do various projects, okay? This was a donation of food and food supplements to this community. What you're seeing here, this is a typical African house. Forget about this in developed areas in Africa. This is a typical African house, and this is a lady receiving a gift from this community. And this is a typical community. These are young children, and this is their mother, and this is their father. So this was a water project launched by the Turkish community through the embassy in one of its organizations. Like you can see, food has been donated to mothers. These are the landfills, like we told you. So they're going to go back into these houses. Education transformation, the Turkish community still has helped in building some schools, and there's a project that is about to be launched that was done by Hayat Foundation in Uganda. So how do we conclude? Africa needs you and me. A lot needs to be done to better the African continent. So as I'm concluding my presentation, I have a small health facility I'm running, which is my enterprise, and I act as the medical director. Inshallah, if you happen to visit Uganda, please feel free to visit me. This is me here, and this is one of our wards. This is one of our patients. This is how the facility looks like, and then this is Dr. Saka, who is speaking to you in his office consultation room. Dr. Shekre Diris, Gurshuruz, this is LC Waikik. Alhamdulillah, it is now in Kampala.
Biz teşekkür ederiz Dr. Mustafa. Thank you for this beneficial speech. I want to answer your questions. I think the young African population is a fortune, and it's a big power with the hardworking people like you. And about the challenges you mentioned, we can overcome by working hard together for humanity, I think. Thank you. If you have any questions, you can ask. Do you have any questions? Okay. I'm thanking you again, Dr. Mustafa, for this beautiful presentation and your participation. And last presentation is from Şevval Cansız from Turkey. Şevval will talk about the diabetes care in Africa.
Hi everyone, can you see my slides?
Yes.
Okay. Now,
Yes, we can see.
okay, I'm Şevval, Nazire Şevval. I'm nursing student. I will talk about diabetes case in Africa, inshallah. Diabetes mellitus. Diabetes mellitus refers to a group of diseases that affect how your body uses blood sugar. And glucose is vital to your health because it's an important source of energy for the cells that make up your muscles and tissues. It's also your brain's main source of fuel. We can see in here IDF estimates show that. In 2021, the IDF 10 edition of the Atlas estimates that 1 of 10 people aged 20-79 have diabetes. This equates to 537 million people in the world. By 2045, this number will increase to 784 million. There still remain gaps in our estimates due to absence and low quality data in some parts of the world. There is a strong need for effective intervention strategies and policies to stall the increase in the number of people developing diabetes. There is a shortage of the data from the African region, so the number of people with diabetes seems less than it is. Africa has the highest increase in the diabetes. We can see in here. As can be seen from this table, the highest number of people who have not been diagnosed with diabetes are in African region. Due to lack of management of diabetes complication, advanced age diabetes patients are not seen in low income countries. We can see in here diabetes complication. Why is diabetes case important? Diabetes has many fatal complications, so the management and care of the disease is important because it's life-threatening. What's the situation with diabetes care in Africa? Currently, there are 19 million adults in Africa with diabetes. Many types 2 diabetes estimated to grow to 47 million people by 2045 unless controlled. This has a considerable impact on morbidity, mortality, and cost in the region. A number of African countries are actively instating programs to improve the care of patients with type 2 diabetes, starting with improved diagnosis. This recognizes the growing burden of non-communicable disease across Africa, which has been neglected in the past. Activities are just starting across Africa to improve the care of patients with type 2 diabetes. Typically, the awareness of diabetes among patients remains a major challenge in Africa, with only a minority of patients currently aware of their diabetic status and being effectively treated, with only a small percentage being diagnosed pre-diabetes. This needs to be urgently addressed given to morbidity, mortality, and cost associated with diabetes. Overall, Africa currently has the highest rate of morbidity and mortality associated with diabetes worldwide. It is estimated that up to 70% or more of cases of diabetes are currently undiagnosed in Africa. Currently, only a minority of patients with diabetes in Africa achieve optimal therapeutic targets. What can we do about the diabetes case for Africa? Diagnosis rates need to be improved to achieve the World Health Organization Global Action Plan, as well as Sustainable Development Goal 3 to reduce premature deaths due to NCD by a third by 2030. This includes access to diagnosis and monitoring equipment and essential medicine in the first place, along with adequate diagnostic facilities giving current cancers with diagnosis rates. The WHO in 2015 found that in Africa only 51% of the countries had metformin routinely available, and only 40% insulin were below the 80% target. There have also been cancers recently with limited availability of insulin analogs when needed, especially with the increasing ability of lower cost biosimilars. However, in the first instance, solute insulin injection as well as intermediate action insulin need to be made routinely available to type 2 diabetes patients within public healthcare system across Africa in accordance with the 2019 WHO EML before portionally funding any analog. The ability of medicine to treat patients with type 2 diabetes should improve with ongoing program across Africa to improve access to medicine in patients with chronic disease. As well as an ongoing program to reduce the cost of medicine as a barrier to their use. Alongside these, many African countries currently have inadequate facilities to manage both the microvascular and macrovascular complication of type 2 diabetes. This includes addressing suboptimal management of patients with type 2 diabetes, with currently only minority of patients in Africa achieving glycemic control. This is exacerbated by low levels of education among patients attending primary healthcare centers facility in Africa with diabetes and cardiovascular disease, including type 2 diabetes and hypertension. However, this is not universal. And there are a number of ongoing activities across Africa to improve the management of patients with diabetes, include the comorbidities. However, more needs to be done, considering the high and growing burden of type 2 diabetes in Africa.
Thank you, Şevval.
Thank you for listening.
If you have any questions, you can ask Şevval. And you can open your cameras for photo if you want. I hope that our program will be beneficial to all of you, especially to African people. Thank you for participating, and see you in our next meetings, inshallah. And first photo. Hatice, you can take.
I'm taking. One more. Smile.
Thank you, all of you, again. Maybe our next meeting will be in Nigeria or Uganda.
Inshallah.
See you.
We will be waiting.
Thanks for your time and everything. Thanks for listening.
You're welcome.
Thank you very much.
Thank you so much.
You're welcome. Thank you, everyone. Our program has finished.
Okay.